I'm here at Keck Medicine, part of USC, and it's not the kind of place where you would normally expect to find artistic inspiration. But one of my friends and one of my favorite LA artists is actually upstairs in a hospital room where he does get a lot of artistic inspiration. And we're going to talk to him. Okay. So, tell us where we are. What's going on?
My name is Dominic Pogliazzi. We're at Keck Hospital of USC. I'm a day out of getting a fundoplication surgery to help with my GERD, acid reflux into my transplanted lungs.
I had an aunt GERD at one point. So I wanted to interview you in here because you do a lot of artwork when you're in the hospital.
Yeah.
So rather than specific pieces, but just talk about the idea of your history with a hospital room and why that's a good place for
Sure.
you to do artwork.
Yeah. So one of the pieces I did about 6 years ago in 2013 was a piece called The Hospital Show. And what I did was I was in the hospital for a cystic fibrosis cleanout, or tune-up as they call them on the West Coast. And for 2 weeks, the first week I made drawings with an acrylic pack that I brought in on paper. And then the second week, I hung the show, and I was in a room similar to this on the 6th floor. I hung the show like it would be hung in a regular gallery space. And then I sent out a press release, it looked very official. And I had people come in to the hospital for an opening, just like they would come in for a gallery show. And really what I wanted to do is kind of bring people in to a hospital space, but out of the context of being actually at a hospital room and more like a gallery space. But I saw a lot of similarities in the two experiences. One, in a hospital, as a patient, the doctors and nurses are coming in and observing and looking. And this notion of looking and observing is also one that you find in the gallery space. You're looking at art on the walls and you're talking and you're kind of diagnosing or critiquing the works. And so I wanted to kind of play with that dynamic, which I saw a lot of similarities as being an artist and being a patient a lot. And so that's why I kind of reversed that and had people come into the hospital to look at art rather than, but also in a way they were looking at me because I was in the hospital during that time.
So most people would look at this room and not see anything of any beauty to draw. And you've done a lot of artwork that's very pretty that's in here, but it also is very pointed. It's things you see a lot when you're in the hospital or things you're going through. So how is it that a room like this that would seem really barren to other people is a creative place for you?
Well, I think two things. I think first is the duration of time you look at something. Oftentimes people are in the hospital for very short periods of time. And the time they're in here, they're in pain or emotional struggle, physical struggle. So their reception to looking at things and seeing things for how they are, what they are, is kind of muted. But for me, I was in the hospital so much for so long, 2 weeks at a time, 3-4 times a year for, years and years and years of my life. I start to see, things like the clock or the hand sanitizer or the Sharps pen, like those things, and seeing them live up to a purpose that they were made for.
It's like they each have a story.
Yeah, they have a story, and how many patients have they seen, and what they've gone through, and what the experiences have been around them. So, and I wanted to try to, I for some of the work that you're talking about, I picked out specific things like the soiled laundry bin, and I painted those, and that just kind of brings to life the story that those are bringing in. And because I've been in the bed so long and just staring at these things, they kind of become meaningful to me.
So how do you compare your creative life outside of here to in here? And was it sort of like a jump? Like you were probably in here a lot before you started using it. as a creative muse?
Yeah, I think, well, because I was born with cystic fibrosis, I was in the hospital a lot when I was younger. Like, as far as I can remember, I was in the hospital like 2, 3 years old, 5 years old, 6 years old. So I was always kind of using art as a way to occupy my time in here. It was like art and video games were like the two things that I used a lot. Drawing, especially when I was a young kid, or coloring books and things like that. But when I was 16, I really started to watch painting shows like Bob Ross was something I would watch. It was on PBS. In the hospital, everyone would also be, my age would be at school, and I'd be in the hospital room watching Bob Ross. And my mother brought me oil paints and construction paper, which is not a very good mix. If you know anything about the two, the construction paper would just deteriorate really fast. But I started painting, and I didn't really think much of it. It was more like just a time passer. But as I got older and I studied more about art, and then I was making art on the outsides, and I was kind of keeping the art life and the patient life very, very separate,
Mm-hmm.
to the point where I was hiding a lot of my illness from the outside world. And when I come into the hospital, I was just that. When I was outside the hospital, I was just that. Until I finished my undergraduate, and I was, in the hospital, and I was probably like in my early 20s, and I was just like starting to bring a lot of my medical experiences, my health experiences, into my studio practice outside. And then over those years, that started to kind of intertwine and kind of wish-wash and I started becoming an artist inside the hospital as well, because I saw it more like a studio. It was like a residency, like an artist would go somewhere for 2 weeks or a month and make directed work. I started doing that in the hospital.
So how's the reaction? So sort of for a final question.
Yeah.
I mean, galleries aren't big on art about. They're not big on a lot of art, but they're not big on art that's not upbeat, not beautiful, not.
Yeah.
So have you been able to find a market? How do you market?
It's been pretty hard. I mean, especially commercial galleries, it's really hard to find a space for art about suffering or struggle or diseased or disabled bodies. It's really, really tough. But over the past maybe 5 years or so, I've noticed not so much in the commercial galleries. That's still kind of staying in like its own little, golden roses area. But there's a field growing in like art and medicine that you know a lot about, and there are I wouldn't necessarily call them alternative spaces, but art spaces plus, I would say, plus hospital, hospital galleries and medical student galleries and things like that. It's in online too. It's a big presence where there's a growing field and like a desire to see more disabled bodies, see more how people deal with sickness in an expressive and visual way. And so that's where my work and my story is kind of headed into that direction. I still do show in art spaces, commercial spaces. It's less often, more so in these spaces that kind of deal with some medical, intellectual, and body-oriented spaces.
I always find it interesting and frustrating that if you write a book about your misery, everyone goes, "It's the most amazing book."
Yeah.
He really lets us know what's going on. But if you paint about your misery, everyone's like, "I don't want to look at that."
Yeah.
And as much as we laud all these great writers, it's really the paintings that can overpower someone emotionally.
I think so, yeah, for sure. A lot of times, when I show work, a lot of people, well, not a lot, but there's a certain faction of people that think it's too heavy. Like a lot of times I get like too heavy is like one of the main comments for somebody that wants to critique the work but doesn't really have the words. They say it's like too heavy, or it's like an emotional struggle to get through, things like that. But the people that it connects to, that too heaviness or the emotional struggle is what they want because they felt that somehow in some part of their life.
It's never patience looking at it saying it's too tough. It's the gallery owners go, "That's not sellable."
Yeah. exactly right. Who knows? It's an interesting breakdown of how that happens. But
All right. So how much longer are you going to be in here?
I'm gonna be getting out sometime in the next 24 hours, hopefully. I've been here for 2 days, and I'm getting some good pain med stuff.
Good. And you can go home and do some landscapes.
Yes.
And paint your dog.
exactly, right. Paint flowers and roses and good things, I guess.
All right. Thanks for talking to
All
me
right,
in
thank
your hospital room.
Yeah, thanks for visiting. My only visitor of the stay. I'm just kidding.
All right. Thanks.
Thanks.